Hello, welcome again to class. Thank you so much for staying tuned. Now, this is animal science. Now, we started with minerals and calcium is the first. Now, we hope to cover others, including phosphorus and the others that are very needful. Now, but so far, we've started with this. We looked at the historical perspective, sources of calcium, the function, and we looked at also absorption and metabolism. Today we'll be looking at the deficiency symptoms. Now if you missed all this, please refer to the previous videos so you update yourself on these things. Now let's start straight into what we have today. Now we're looking at the deficiency symptoms of calcium. Now first of all, calcium deficiency is actually called hypocalcemia. Now let's break it. It's a bit bigger. It's a bit big. So this is hypo. Like I said previously, you can divide scientific terms, some scientific words into 2 or 3 or so syllables, so you'll be able to know what it is. Hypo will mean that it is in low level, or level that is not up to the required range. Then calcemia, amia. From here, it means shortage or in the blood. Now what that means is low calcium in the blood. Hypocalcemia, meaning low calcium in the blood. Hypocalcemia. Now these terms are very, then we see sickle cell anemia. Anemia, that is in the blood. Anemia or lack of blood. Now, this is the causes of deficiency could be any of this. It's either you're not taking enough calcium in the food, or you're excreting too much, or the body is not able to absorb even the much that you take. Now, let's go by it again. You're either not eating much, the animal is not eating much, or the person is not eating much. For example, now if you're a farmer, you're conscious about why your birds are not laying strong-shelled eggs, or your animal, your male, let's say the kid, or let's say the lamb are not half strong. It's either they are not having enough calcium in their meal, which is in their diet, or there's physiologically a deformity in the absorption of calcium. We talked about that during the previous class when we looked at absorption of calcium. Please, you want to make reference to it. Different hormones that are responsible for that. Now, or a situation where it's even in excess. This is also another physiological one. This is nutritional, physiological, where it's excreted too much via the renals. That is, the kidney excretes it, and then so much of calcium is lost via urine. So this one you have to take care of this. Now, what are the common symptoms you would notice when you have hypocalcemia? Now, let me go back to this. Anytime you see hypo, like I said, it means low. The opposite of it is hyper. You already have had hyper this. That is an excess. Hypo means lower, beyond normal. Hyper means too much of it. Now, in this case, now let's come to the common symptoms. Now, let's look at whether you're talking about whether cattle, sheep, or goats, or you're looking at birds. The young will have ailments that has to do with the bone. In human, it could be called rickets. You see a situation where the bone is soft or weak, and it leads to deformity. In which case, you could see some shapes of bone of the leg that is not acceptable, that is not right. Then in adult animal, you will have osteomalacia or osteoporosis. Osteomalacia. If you look at these two terms, you see something is common. Osteo. In Latin, the word osteo means bone. So these are how you break words, you get to know the meaning. Osteo means bone. Malacia, deficiency of porosis, that means loss of it. It's porous, it's escaping. Now let's go over them one by one. This one is more physiological, and this one is more nutritional. In which case, this one is factored or caused by age. When people are getting older, their bones get fractured easily. That's why you don't involve in certain level of activities that are too much, that are so intense, so vigorous when a person is getting older, because of fractures that can happen if, especially the person is having osteoporosis. There's a loss of bone density. The mass of the body, the bone density is actually reducing, it's actually losing. And that's because of hormonal imbalance. Hormones are hormonal imbalance. The hormones we listed previously in the other class, calcitonin and the others, are not in the right proportion. Hormonal imbalance can lead to osteoporosis and age. In other words, when you're aging beyond a certain level, a certain age, you begin to have osteoporosis. Now, coming back to this one is osteomalacia. It's usually caused in deficiency consumption of calcium. So this is why deficiency occurs. So the both of them, you see, the bones are actually prone to fracture. Both calcium and vitamin D deficiency causes this. This one, deficiency of calcium and vitamin D, this is age-related, hormone imbalance related. So physiological and nutritional. Now, the bones are brittle, that is, they can easily break and they are prone to fracture. Now, the next common symptom we talked about in young, we looked at soft bones leading to deformities, and then in adult, osteoporosis and osteomalacia. Now, we look at the muscle symptoms. Now, when we talked about the functions of bone, we said functions of calcium. We said calcium helps in contraction of muscles. How about it, the calcium is not there? It's going to now affect contraction of muscles. So this is it. Now you see neuromuscular symptoms, in which case you begin to have cramps, muscle cramps. What is generally called, wrongly called, muscle pull. And then you begin to have spasm, like twitching. You begin to see the muscles twitching, like twitching, shaking. And then you can find numbness. Numbness means the situation where you can't feel pain in a particular part of the body. You just discover that a particular part is just numb. That is, you can't feel pain. You hit the place this way, you're not feeling the pain. It could be any part of the body. It could be a sign of deficiency of calcium. So numbness, spasm, which is kind of twitching, and cramps can be factors that show that there's deficiency of calcium in diet, or too much loss of calcium, or inability to absorb it. Now these three, do not forget them. Then you also see another symptom of it is dental problems. You talk about for cattle, sheep, goat, or any of your ruminant animal, the teeth are not properly formed, and when they are formed, they are either weak teeth, weak, not strong, easily broken or easily falls off, or they begin to delay teeth formation, whether in human or in cattle, sheep, goat, or others. In birds, of course, the beak and the beak form, but then you just discover, we'll come to birds, you see the shells are not having strong shells. Now, some ailments can lead to it. Some ailments, some other symptom that is not related to this. But then the primary problem why you have soft shell eggs is shortage of this. Now, how do you solve that in poultry? In poultry, you increase calcium intake. See that you increase in their feed additional quantity of limestone crushed, or additional quantity of bone meal, bone burnt and then crushed. You have to increase the quantity. So bone itself is over 90% of calcium itself. So you introduce it back into the feed. The poultry birds eat, and then they jack up calcium content in the blood. Then we look at cardiovascular symptoms: abnormal heart rhythm, abnormal heart beats. Now these are some of the things these are the things we have for deficiency symptoms of calcium. We looked at what hypocalcemia is. We've broken it down, making it simple. We also looked at osteoporosis, which are the symptoms you find in those which are in young. We find deformed bones, osteoporosis, loss of bone mass, bone density, and then bone is easily fractured, and then we'll look at the problems of cramps and spasm, numbness, also dental problems, and then cardiovascular problems, heartbeat. For poultry animals, for poultry birds, you have the eggs shell are actually not strong. I want to thank you for staying tuned. Thank you. Now we've had this calcium from the beginning. We looked at historical perspective, but we'll say calcium. Now this is drawing the cotton. Calcium got from the Latin word calix, and the ancient took it in milk. They took it also from drinking from spring water. We looked at the sources from dairy products mainly, and also from taking green vegetables and others. We looked at the function of calcium for strong teeth, for strong bones, and also for muscles, for good muscle flexing, nervous impulses, and the others. And then we looked at deficiency symptoms, which is what we're looking at today. Bones and teeth are weak, and then you have egg not having strong shell. But we also looked at absorption, some vitamin D being necessary, some hormones that causes imbalance. If they are too much, it's going to, if it's too much, it's not going to be absorbed properly, and then if some hormones are not insufficient enough, it's going to affect absorption and the others. And then we looked at metabolism, the breaking down of these things. Thank you so much for staying with us in this class. I want to advise that you join us in the next class. We're going to have another minerals we're going to be looking at. You want to know what we'll discuss about in the next class. Please stay tuned. Thank you so much. I love you. Thanks.